Hello everyone, welcome to my channel. In this video, I'm going to be giving you a step-by-step introduction to the process of practicing medicine in the United States of America. Without further ado, let's get started. To practice medicine in the US, the process is actually one, whether you're trained in the US or not. Let me just give some definition of things. We have the IMGs. IMGs stands for International Medical Graduates. International medical graduates are simply those that are trained in medical schools that are not in the US. So that decision is actually quite important because it actually affects your match chances to some extent. Okay, so that's another to clarify is the USMLE. What the USMLE stands for? USMLE stands for United States Medical Licensing Examination. So let's break it down. United States Medical License Examination. So it's an examination you take to get your license to practice medicine in the United States. Simple and short. Now, what does the USMLE comprise of? USMLE has exams, actually has 3 exams, step 1, step 2, step 3. Now, in the past, step 2 used to have 2 arms, step 2 clinical skills and step 2 clinical knowledge, okay? But now, step 2 clinical skills have been scrapped and you only have step 2 clinical knowledge. Step 2 clinical skills have actually been replaced by the occupational English tests. So the role of step 2 clinical skills was to test if you can really apply the knowledge, your clinical knowledge, and apply it to patient, interact with patient, get history, examine patients. So, but it has been replaced by OET. OET stands for occupational English test. It tests your ability to communicate in English language in a healthcare setting. All right. Like I said, the USMLE part, we have step 1, step 2, step 3. We have the OET. So let's start from the beginning. Assuming from the scratch, what do you do to practice medicine in the US? The first thing to do is to get an international passport because that's the only way your identity can be verified. So if you don't already have an international passport, you have to get an international passport. Now, the second thing you need to do is to apply for ECFMG certification. Right now, there's a transition between the ECFMG. ECFMG stands for Educational Commission for Foreign Medical Graduates. Okay, it's the body that previously used to handle everything concerning the USMLE exams. But right now, there's a transition to My Int Health. So there's some changes in the terminologies and changes in the processes, but the general guidelines still remains the same. After you're getting your passport, you have to get verified. You have to apply for an ID. You have to apply for previously it used to be called ECFMG ID. I guess with the new changes, only I will call that, but you have to apply for an ID. You have to get verified. So that process in the new My Int Health platform, it will cost you a total of $560. Previously, it used to cost around $160, but now $560. Okay, so you get that door with. So after that, that what qualifies you to apply for the steps and write them. The US health system is not like many countries' health system where you can get in and start practicing as a medical officer, as a general practitioner, just like that. No, you have to go into a residency program usually and get trained, become a specialist before you can and then you practice also by the US health system. That's the standard pathway. There may be some new changes in the future or some things currently changing right now, but classically, to get into the medical system, to practice medicine, you have to go through a residency program, become a specialist, then you can practice unsupervised. Okay, so what does it take for you to get into the residency program? It takes your step 1, step 2, occupational English tests. That's basically all. Step 1, step 2, occupational. Now, what of step 3 you're asking? Step 3 is not compulsory to match into the. Sorry, it's not much. I'm a bit ahead of myself. I'll explain what match means later. But step 3 is not compulsory to start practicing medicine in the US. You can write step 3 when you start residency training. So it's not compulsory. Though you can write it before you apply. It's said to increase your chances a little. So that is that. Okay, so you have to, now we have talked about passport, you've talked about getting verified, getting an ID. And next is step 1. You prepare for step 1 exam and you write. Now, what is step 1? Step 1 is simply an exam that tests your basic knowledge, knowledge of the clinical sciences. This is like anatomy, biochemistry, physiology, pharmacology, pathology, biostatistics, to some extent, behavioral health also, epidemiology. So it tests your knowledge of these basic clinical sciences. So step 1 exam has about 280 questions. You take the exam in a day. There are different test centers in different countries. For instance, in Nigeria, there's no test center for step 1. The nearest test center to Nigeria is in Ghana. So write step 1, you have to go to Ghana. It's a 1-day, 7-hour exam. While step 2 is an 8-hour exam. Step 1 has 280 questions which you will take over a period of 7 hours. Of course, there'll be breaks in between, but just so you know, I've told you that it takes your basic knowledge of basic clinical stuff. So you have to prepare for step 1. You can refer to my video on how to prepare for step 1 on this my channel. So when you are done with step 1, prepare for step 2. Step 2 is test your clinical knowledge, statistics and gynecology, psychiatry, internal medicine, pediatrics, surgery, and some other specialties. So it tests your ability to actually make diagnosis, investigate patients adequately, and treat them. A common type of question in step 2 is what is your next best step. So basically assesses if we know what to do when a patient is in front of you. Okay, again, you can take it, there are different centers. You might not take it in the US. If you're in Nigeria, you have to take it in Ghana, or you can go to the UK, you want to take it in UK. That's fine. Obviously, in the United States, there are multiple centers. But that you have 220 questions, which will take over a period of 8 hours. Yes, the order of the exams, you must not write step 1 before step 2. So much as it shows that step 1 comes chronologically before step 2. But if you have graduated, you are in clinical practice, it may be easier for you to start preparation for step 2, because step 2 is more clinically oriented compared with step 1. So after step 2, you write your operational English test, or in the process, it must not be after step 2. You can write OET before step 2. And when you have those 3 exams, you can then apply to be licensed to practice medicine in the US. During that process, your deans will have to send your transcripts, your certificate to confirm you as someone that trained in his school. Okay. And some of that things you do along the line, you have to get a certificate of good standing. Eventually, you get licensed to practice medicine. And that's that license that gives you the ability to apply for the match. Now, what is the match? You get in through the USMLE via residency programs. We have to be trained as a resident in a particular specialty, in a particular center. So there are different centers with different residency programs, while there are different candidates apply for different residency slots in different centers. So there has to be a match process. What I mean by a match, I as a candidate can apply for multiple residency programs, up to 50, 100 residency programs. Different residency programs, I get different applications, and I select a list of people that I select from the list of people I have. I select those I'm interested in. So if a center I applied for, they are also interested in me, we can then match. The process is more complicated than that, because multiple centers may choose one person. There's something we call rank order list, where you say, okay, if multiple programs select me, my priority is this. And also, residency programs have their own order list too of candidates they want in the preferred order. So it's a whole complex algorithm. But basically, the match process means a residency slot in a particular center is matched to a particular candidate, but that candidate can start practicing medicine in the US as a resident physician. There are different types of visa. We have the H-1B visa, we have the J-1 visa, all right? After you match, you have to get your visa. I may make another video sometime later about the types of visa, but you also have to get the visa so you can travel to the US and start your residency training. Eventually, you write your step 3. If you didn't write it before, you applied for the match. So I guess that should be all. Please do like, share, and subscribe to the video. If you have any questions, please drop it in the comment section. See you in the next one.